Well, Downing Street says the spread of the Indian variant could pose a threat to plans to ease all remaining lockdown measures next month. From today, anyone over, I think it's actually 36, can get vaccinated. And the minister telling us earlier on they want to bring that down quite quickly, so it may well be 35 tomorrow. Let's talk to the President of Epidemiology at the Royal Society of Medicine and a member of the Independent SAGE Advisory Committee, Gabriel Scally, who joins us now. Good to see you this morning. Look, in terms of where we're seeing these pockets of Indian variant, what do you think is the best way to try to tackle that?
I think, at the moment, the pockets, there are a lot of them, 86 with 5 or more cases, but some of them, they're not all the same size. And in the areas like Bolton or Blackburn, where there are significant numbers, we really should be throwing the kitchen sink at this to try and get it down. And that means the vaccination, and it's great that at last they've been given permission to vaccinate people from 18 and over. That's fantastic, and that'll make a big difference. But there are lots of other things. Really good contact tracing and finding of cases and support for people to self-isolate to stop the spread is really important. And for some reason that is not really explained, until now, England hasn't been testing people at highest risk. It hasn't been testing all of the close contacts, but rather waiting for them to develop symptoms before offering them testing. So that testing, really good test and trace for a change, is really what we need. As well as that, we do need a lot of vigilance and a lot of information to the public so that they understand that the virus hasn't gone away, it's still there, and it may be much, much more infectious. We also need to stop the importation of it, and that means better border controls, a proper quarantine system. We've been let down badly by the large number of cases that the UK has imported of this dangerous variant that was first identified in India. So there are a string of things that could be done and need to be done.
OK, look, you raise a whole host of issues there. Firstly, can we talk about the vaccinations then? Because I mean, quite what is happening in these areas with surge vaccinations seems to be unclear. I mean, it's certainly not sanctioned by the government. I mean, the ministers are not saying that they're approving this. So who is approving this, and can it be done in more areas?
Well, what is happening is that the local directors of public health are taking control. They haven't been given the power previously. They haven't been given the resources to do their job. And that's why some of these communities have found themselves in consistent lockdown or consistent restriction. And the directors of public health, I think, have lost their patience, and they're starting to make the decisions. And they should be empowered to make these decisions, and they should be given the resources to do what's needed. You cannot run this pandemic from Whitehall. If we've learnt something over the last year, it is that. We need local response, and it needs good local public health action and local public health decision making. And that's what we're starting to get. OK, and then from a national perspective, I mean, England, for this particular example, if it is necessary to try to stop this, say, highly transmissible variant from becoming dominant across England and then the UK, a local lockdown, something which, I mean, although regrettable, you would support? Well, I think certainly local restrictions to get it under control, but hopefully we will be doing much more than just putting on restrictions. Sometimes it seems we're like a one-trick pony. The only thing we know is shutting things down. And that's bad for people's health, it's bad for the economy, and it's a bad way to tackle an infectious disease. We do need outbreak control, and that's a whole range of measures. And that includes simple things like improving the ventilation, actually putting some resources into paying for better ventilation in our schools, in our workplaces, ensuring people have fresh air and can stay safe. There's a whole lot could be done at a local level if they're given the power and the resources. I mean, isn't there an argument to say local restrictions plus surge vaccination at this time could actually, 3 weeks down the line, could have a huge impact, couldn't it? It could have a large impact, and this is sort of classic public health response to an outbreak and an upsurge. And we better get used to it, because we're going to, whatever we think, we are going to experience outbreaks and upsurges of COVID-19 going forward, and we need to get prepared. And we should look at this as something that's going to have to be done, maybe for months to come. whenever we get these outbreaks or surges.
Look, we're almost out of time. Can I ask you about the travel situation? You said more needed to be done to stop things like the Indian variant coming in. But I mean, does that raise concerns for you for all international travel being opened up, even in the limited way that it has been so far?
Well, I have great concerns about this particular variant because of its much more transmissible characteristics. And it hasn't really taken off in Europe yet. And if it takes off in Europe, I think we're in for a very rocky time because, of course, vaccination levels are not at the same high level as they are in the UK, in much of Europe. And at the same time, we're reducing travel restrictions, and many more people are disappearing off on holidays and will come back and not necessarily have any really managed quarantine. And we know self-isolation doesn't work. And I'm really worried about a big wave in Europe if this very transmissible variant or another one that comes along can take off. So a good quarantine system on our borders is absolutely essential.
Gabriel Scally, good to see you. Thank you.